Dr. Mukhtar Relima. Welcome back to my channel. Today, let's talk about a very important issue that affects children, and this is bedwetting. A number of parents are frustrated if their children bedwet, and they, because of that, tend to punish them harshly or they tend to shame them for bedwetting. But there is no need for that because parents should realize that bedwetting or enuresis is a medical condition and it is not a deliberate act of the child. So, bedwetting is a condition in which the child urinates at night on his bed while sleeping. It is a relatively common condition as up to about 10% of children who are around the age of 7 usually bedwet. It is a little bit commoner in boys than in girls, almost about twice as likely to occur in boys than in girls. So it is a medical condition and there is no need for parents to feel frustrated. There are many interventions, available treatments that can be given to the child to help. But most importantly, it is good to know that bedwetting is a condition that children tend to outgrow. Hardly do you find a young adult bedwetting, and most children before the age of 5 are bedwetting. So, what are the causes of bedwetting? A number of causes, but the principal cause is a relative delay in maturity of a group of muscles that control the outflow of urine from the bladder. The bladder, if you liken it to a sac that holds urine, below it there is like a tap which can be turned on and turned off. So, what helps in turning on and turning off the flow of urine from the bladder is like a tap, right? So, that tap is made up of those group of muscles that we call sphincter or sphincters. So those sphincters tend to mature slowly in some children, whereas in other children they tend to mature promptly. And that's why in some children, before the age of 4, they have already achieved continence, which means they hardly bedwet. Whereas in other children, they will not stop bedwetting until maybe after 8, 10 years. This is not their fault, however. Why is it not their fault? It is because of the delay in maturity of these taps or of this sphincter. Now, another important point to note is that the maturity of this sphincter is determined to some extent by genetics. And that is why if you find a child that is bedwetting, if you look back, there must have been an uncle or even a dad who has bedwetted, but now he's a grown up and hardly does even talk about it. And that is a good news. Parents should realize that this is something that their children are going to outgrow, and this is something even before they outgrow, there are medications and there are interventions that can be given, which we're going to talk about in this video. The second cause of enuresis, apart from this delay in maturity of the sphincter, is that some children tend to have urinary tract infection. When children have urinary tract infection, it tends to cause irritation of the bladder, and that makes it very easily for one to want to urinate, even in adults. So if it happens and the child is sleeping and the bladder is irritated, he easily releases the urine. And that is why when a child comes and he's been evaluated for bedwetting, we usually do some tests on the urine to see whether there are those organisms that might be causing urinary tract infection. So this is the case in some children. Another condition that can cause children to be bedwetting is if children have a medical condition like diabetes mellitus. There is a type of diabetes that affects children. It's called type 1 diabetes mellitus. This is a type of diabetes mellitus in which the children do not produce insulin at all. Therefore, they do not control their blood sugar level, and therefore the blood sugar level tend to make them urinate a lot. And at night, because the bladder is full, before they know it, they easily urinate on bed. So by and large, these are a few medical conditions that can be responsible for causing a child to have bedwetting. But the most important cause is delay in maturity of the sphincter that control the flow of urine from the bladder. This is usually found to be genetic in most cases. So these are the important causes of enuresis or bedwetting. And there are things we need to point out here just so that parents of children with this condition do not continue to do those kind of practices. One of those is that children with enuresis or with bedwetting tend to be shamed. You find that in a local neighborhood, a child that bedwets in the morning, all the siblings and even children of neighbors are called around to start singing and shaming him generally. This is an unhealthy practice because it tarnishes the self-image and the self-confidence and the self-esteem of this child. and it is a problem that the child is going to outgrow. And but unfortunately, even when he outgrows it, those children that have been laughing at him would always remember that this guy has been a bedwetter. So you see, this is a problem, even if he becomes a governor, right? So it's not advisable for parents to do that. The second unhealthy practice is that some parents tend to punish their children harshly simply because they bedwet. This again is not encouraged, is not a deliberate behavior of the child. Instead, the parents should seek medical attention, and there are effective medications and effective interventions that we're going to talk about in this video. Another unhealthy practice is to engage in some traditional interventions. It is not uncommon for children in northern Nigeria, especially, to be forced to ride on a hyena, because maybe there's this belief that maybe if the child rides on a hyena, the living daylight is going to be scared out of him, and he will, because of that, stop micturating or stop bedwetting. This is an unhealthy practice. Again, it should be discouraged. Another unhealthy practice around bedwetting is maybe some parents will ask their children to be taking some certain traditional concoctions that they do not know where they come from. This might add disease to the child, and it's generally discouraged. So, having said that, are there treatments? Yes, there are effective treatments, and we encourage parents to seek for them at the hospital. But what are they? One of the most important treatments that are available is the use of what we call Enuresis alarm. They are some forms of alarms that are found as part of a diaper that the child usually wears at night. How they work is that anytime the child begins to urinate inside the diaper, the alarm is triggered off and it begins to sound, and that will immediately wake the child up. As soon as the child wakes up, he is asked to go and complete the urination in the bathroom. Now, tomorrow that happens, and as soon as he urinates, that alarm is also triggered, and he is woken up and he goes to empty the remaining urine in his bladder. That happens over a number of times, and it reaches a time when, even before he urinates, he feels the natural drive to wake up and go to the bathroom and urinate. This happens because the alarm has helped the child to synchronize in his brain the time at which his bladder is full with the time that he ought to wake up and go to the bathroom and empty his bladder. That is the mechanism, and that is why it is one of the most effective treatments for enuresis, also called bedwetting. The second form of treatment is called behavioral interventions. These are generally education that we usually give to parents and children. One of them is that at night, encourage the child to go to the bathroom to empty his bladder before he goes to bed. Let him do that twice. Let him do that like 30 minutes before he goes to bed, and then at the point of going to bed, let him go to the toilet and also empty his bladder. Another behavioral intervention we advise parents on is to discourage the drinking of too much water and fluids in the evening, especially at night prior to going to bed. The next category of treatment or intervention that is available is the use of medications. There are different kinds of medications, but there are two important ones I'm going to talk about here. One of those medications include treatments that, when they are given, they act on the bladder to reduce the amount of urine that the child produces. So if he does not produce a lot of urine, it means that the bladder is going to be relatively empty overnight, and it means that he's going to not likely to urinate. These are medications that are given short term. Maybe the child is going to go and sleep overnight in friend's house and he doesn't want to embarrass himself, and so the parents will now ask for that kind of medication, and he is given the medication. This type of medication is usually given only short term, and they are given in several ways. One of the ways in which these medications can be given is by spraying them in his nose. The second category of medications that are available are those medications that go to the bladder and strengthen the urinary outflow. We said earlier that the bladder is like a sac that is controlled by something like a tap. So the role of that tap is usually done by the sphincter, those group of circular muscles I talked about earlier. When these kind of medications are given, they go to the sphincter and they strengthen them, so that at night, even if there is urine in the bladder, the sphincter is strengthened, and therefore it will not allow urine to easily come out of the bladder. So by and large, these are some of the things that parents should know about bedwetting, and that they should know that it is a medical condition, and punishment and shaming the child does not help. And in most cases, in fact, in almost all cases, children with enuresis tend to outgrow it. All right, that's it for today. Thank you for watching.